Hello and welcome. We are here with Vickie live. Hi, Vickie.
Hello, Marion. How are you?
I'm doing fantastic. How are you?
I'm doing good. I'm doing good. Busy, busy, busy. Getting ready for uh, the annual enrollment period for my Medicare beneficiaries to educate and push forward and make sure everybody's ready. So I'm doing good.
Yes, I understand that's coming up very fast. And
Yes,
it seems like it's going faster and
just like that.
faster. It's
Yeah,
just amazing. Yes. So
yeah,
we're doing the annual enrollment, which means people can think about starting Medicare or switching their Medicare,
yeah.
correct?
Correct, correct. So
Okay.
annual enrollment period is for those who are Medicare beneficiaries. It's just a reminder. It's for those who are Medicare beneficiaries who are on a Medicare Advantage plan or have Part D that they make changes during this time. It's time for you to review your plan, make sure that you're on the right plan, whether it's a Part C or Part D plan um, for the new year. This is the only time you can actually um, make changes, um, numerous changes, as I say, and do a really good look at what other options you have. It's also a time for people who are on a Medicare Advantage plan. If they want to go back to original Medicare, they can do that also during annual enrollment period. One of the most important pieces of Medicare and your health care is really your medications and how you receive your medications as a Medicare beneficiary. So that's what we're going to be talking about today is um, the Medicare Part D prescription drug program that Medicare has established for Medicare beneficiaries because it really is one of the things that just one of the things that drives your costs when it comes to your healthcare costs within the Medicare program. So that's what we're going to talk about today.
Okay.
Okay. Just a real quick review. Medicare is composed of four parts and Medicare supplements. Parts A, B, C, D, and then you have supplements. Um, A is your hospitalization piece, what covers anything that has to do with you going into the hospital, out of the hospital. Um, Part B is all your preventive maintenance healthcare issues. Part B covers that. Part C is a combination of Part A and Part B. In other words, you have to have Part A and Part B to be able to get a Part C, which is the Medicare Advantage plan. And the Medicare Advantage plan has to meet or beat whatever Part A and Part B of original Medicare um, uh, basically provides. Majority of the Medicare Advantage plans have the Part D, which we're going to talk about today, uh, included in them, but not all of them. So you,
Why would some have it and some not? Is there a reason that they?
well, yes, it really they are trying to provide options for beneficiaries who have health insurance in other directions. In other words, so some of the plans are set up, for I'll always fall back on myself for veterans.
Oh,
Basically,
okay.
so if a veteran uh, maybe they're not located in a area that's close to a facility or a clinic or whatever, then that means that there are Medicare Advantage plans out there for that veteran, but the veteran still wants to use his prescription, get his prescriptions from the VA. He can do so because the VA, of course, mails. You have the option of being able to mail out your prescription. So, you know, but there's TRS. There's a lot of different options. Any employer or union uh, organization that has a retirement plan for individuals, their prescription piece might be better than a Part D plan out there in Medicare. So they are able to get a Medicare Advantage plan, such as a PFFS or a Medicare Savings Medicare Savings account plan. With those two Medicare Advantage plans, they can have separate Part Ds. So all the rest of them really actually include that. And so you just skip me right into how do you get your Medicare Advantage plan? So that was a good question, Marion. Very good question.
Well, good. Well, it crossed my mind, so I figured it might cross somebody else's mind too.
Yes, yes, yes. And so um, Medicare Part D is your prescription drugs for your Medicare. All right, for your health care. Um, it comes in you can basically receive Part D two different manners, what I just said. You can have it through a Medicare Advantage plan, or you can get it separately, independently, and still keep original Medicare. So it has there are standalone plans. All right.
Oh, okay. Okay.
Okay. They're standalone plans. So with the standalone plan, but the standalone plans and the um, uh, plan prescription drug piece that are included in the Medicare Advantage plans still abide by the same regulations and rules that Medicare has set up. So they're standardized. Basically, Medicare has standardized the um, different. Not different, but it has standardized Part D. So they have to be the same whether you're receiving Medicare via a plan, a Medicare Advantage plan, or if you're just getting it on the standalone piece. So let's see. So that's basically how you receive Medicare. Now there are 4 stages to Medicare. There's the deductible stage. That's stage 1. So you have to meet your deductible before you would basically go into a cost sharing mode with the insurance company that you have your plan with. Okay, so each year the deductible has changed, and we don't know what 2021 is going to be at this. Well, I do know, but I can't expose that.
Do you want me to show the slide that has the 4 stages?
Yes, please. If you can disclose it. Yeah. So we've gone through that one, but it's the next slide, I do believe.
Okay, let's see. Let me see if I can pull up the next slide.
Well, it's actually we're in the 1, 2, 3, 4. It's the 5th slide that I'm talking about the stages now.
Okay. So, okay, I think I know which one you're talking about.
It's the very colorful one.
Oh, okay. Yes, that's okay.
Yeah, it's the very colorful one. So,
I like color.
So, but anyway, so while you're pulling it up, I'll continue talking about it. So you have your not that one. It's another.
There's only one other one that has color on it.
Yeah, well, it's the 5th one, the one almost to the end. So.
Oh, okay. See, you're going out of order.
Well, I went all in order. I just talked through all the other 2. I just talked through all the rest of them. I was like, okay, yes, that's the slide. So this is. I always like to try to show these things in a graphical or picturesque view, because a lot of people will capture it and remember it, when it's kind of picturesque. So this is my way to show my artistic what little artistic abilities I have is through a slide presentation with colorful boxes. So anyway, we move right along. And like I said, we just talked about the deductible. The deductible changes. Medicare basically changes the deductible every year. So we don't know we do know what 2021 is, but it won't be announced until October 1st. So, but you have to meet your deductible prior to you actually going into the next stage, which is the initial coverage stage. And this is where your cost sharing starts. But within the deductible phase, you will be paying for your medications, your brand name medications, at 100%. So if you have generic medications, you will basically be in a cost sharing mode. So you will be in the initial coverage stage with your generic medications. But with your brand name medications, you will basically still have to pay 100% of your brand name cost in the deductible stage until you meet your deductible. Okay, so um, once you do meet your deductible, then you move into initial coverage stage. And how the initial coverage stage is set up is basically that you will pay 25% of your cost of your medication through a tier structure and copays. Okay, your insurance company, with whatever plan that you have, will cover 75% of it. But in this stage, however, like I said, it's a tier structure for your medications. You will have generics, brands, and specialty medications. So your tier one and tier twos are your generic medications. Tier one is your preferred generic medications in the plan that you're in. Tier two is the non-preferred um, generic medications for the plan that you're in. Tier three is your preferred brand name medications in the plan that you're in, and tier four is the non-preferred brand name medications in the plan that you're in. And then tier five is your specialty medications. Those are usually the ones that are driven by really chronic conditions, cancer type of things like that. So those are your tier five. So of course, those are the more expensive medications if you're on them. With with all the uh, plans, in other words, the carriers, the insurance companies. When I say carriers, I'm talking about the insurance companies. They're the ones that you get your plans from, are the insurance carriers, and each insurance carrier has a set of medications which they call formularies. Medicare requires every plan to cover or have at least two different medications for different conditions. And so plans, when I say plans, I'm talking about the insurance companies who sponsor the plans, their formularies can be adjusted for cost effectiveness and being able to provide beneficiaries the right medication at the most economical cost. So each plan, I say that because each plan, their formularies could be different. So a medication in one plan could be a tier one, in another plan it could be a tier two. And that's why I say that, because each plan is going to have their own formulary. In other words, a list of their medications that they're going to offer. They have to cover and have two types of medication for the same chronic condition. So in other words, if you're diabetic, a type 2 diabetic, of course, I always bring that up because I am one. If you're type 2 diabetic, then every plan has to have two different types of medications that treats that condition. Everybody knows metformin, so I'll use metformin as an example as one of the one of the medications that a plan might have to treat diabetes. Well,
Every time you say that word metformin, I think of some golfer. I don't know why. I don't know why.
well, there is a golfer out there that I think talks about. I'm not sure. He does a commercial on some medication. I don't know. I don't know if it's metformin or not. But he does do a a commercial for some type of medication. So who knows?
Who knows?
But back to the example, metformin is a medication that's used to treat diabetes. People who have type 2 diabetes. Well, metformin in one plan may be a tier one, and that means that the cost is going to be, at a tier one level. In some plans, a tier one is at a zero cost. Some plans, a tier one is a $2 cost, or whatever, for 30, pills or whatever. So that's in one plan. I'll just use company. I'll just use Humana for example. I have no idea whether that metformin is so. I don't know what it actually metformin is in Humana plan because they have so many. But in say devoted, it is a. I won't use devoted. Over at Aetna, I'll say that it's a tier two. Okay, so the cost is going to be different from that medication from plan to plan. All right, so you have tier one in Humana. It's they're saying that it is a tier one, so maybe it's their tier one medications are zero. Over in Aetna, it's that same medication of metformin is a tier two. So now you're going to pay tier two costs, which can be from $5 to $10. So you're going to basically be paying a little more for that same medication in a different plan. So that's
Right,
why
I understand that.
now you understand. So that's why it's important to really review your plans and look at your medication
Yes, yes.
and verify that your that the plan that you're in, that the medication is going to follow the same tier structure that you got in the plan for, if it was for, to keep your costs down. Okay,
Right.
so but as I say, you have tiers 1 through 5. Tiers 1 are going to be your lower cost medication because they're your generics, and then 5 is going to be your more expensive medications. Okay.
Okay.
All right, and you pay co-pays on that. Or this is your cost sharing. If you're cost sharing in stage 2, which is the initial coverage stage that we're talking about, you're doing cost share with the insurance company. You're paying 25% of your medication. They're paying 75% of your medication. Now, once you reach you only stay in tier 2 for a certain period of time. Okay, and it's all dependent on your medication cost. Okay, now in 2020, the tier, the your maximum out of pocket was a little over 4,000. It was 4,000, I think 80. We're already moving into 2021, so that's what I'm thinking of right now. But your tier 2 maximum cost of your medication was a little over 4,000, and when you reach that number, I always call it the threshold number. When you reach the threshold cost of your medication from one tier to the next, you're going to move out of that particular stage. Okay.
Okay.
I misstated, not tier, but once you hit that threshold number, in other words, the total cost of your medication in we talked about stage 2 now, then that's when you move to stage 3. Okay, and that total cost of your medication is not what you're paying, but it's the total cost of your medication that you paid. That means that's the deductible, what you paid in the deductible, what you paid in in stage 2, as well as what the insurance companies have paid. Okay, so it's a combination of all the costs all the money all the cost of your medication, I should say, just the cost of your medication. Once the cost of your medication reaches that threshold amount, you're moving to the next stage. The next stage being stage 3. Now, stage 3 is what a lot of beneficiaries know as the donut hole. Probably have to move away from that term, the donut hole, because as in 2020, the donut hole ended. And even though there's still a stage 3, the concept of the donut hole really changed.
Do you still want this slide up?
Yes.
Okay. Okay,
Yes,
the concept of the donut hole changed?
Yeah, the concept of the donut hole changed in that the cost of your medication in the donut hole once used to be that it was your brand name medications was a certain percentage and your generics were a certain percentage. But now they're all the same. So when you move into stage 3, you're no longer paying for your medication in a copay status. You're now paying for your medication based on percentage of the medication. So in other words, if you have a medication that was I'll just say a tier 3 in your initial coverage stage, and you were paying $40 for it, But that medication actually costs $200. Okay. Now, when you move into stage 3, the coverage, the coverage gap, you're now going to be paying a percentage of that $200. So it's not going to be just a flat copay anymore. Now you're going to pay a percentage of the cost of your medication. Understand?
Yes.
Okay.
Who
So
keeps track of all this?
Medicare, believe it or not, Medicare and the insurance companies actually, because every time, believe it or not, every time you go and get your prescription filled, it is recorded by your insurance company who has your plan, and that is filed with Medicare. And if you, as a Medicare beneficiary, if you're been a Medicare beneficiary, you should be very familiar with Medicare.gov as well as your insurance company's formularies. Insurance companies will send out a monthly statement on your drug costs. That's the nice thing about it. You can keep up with your drug costs or your medication costs because every insurance company who has a Plan D plan has to send you a monthly, they're required by Medicare to send you a monthly statement of where you are with your medication costs. And they break it down based on this structure we're talking about right now, the 4 stages. So
Okay.
they let you know where you are as far as the cost of your medication and what stages you're in. It's in your monthly statement.
Now, if they
So
have a question, do they call you or do they call Medicare?
they can call me. They can call me because
Okay. And your phone number is right on the screen right now,
yes.
281-849-8373, or your cell,
Mm-hmm.
713-444-3269.
Correct. So for because I don't want us to run out of time to get through all this. So your coverage gap stage 3, you're paying your cost sharing is done through percentages. So for all medications now, you're paying 25% of the cost of the medication. All right, not a flat fee copay, but the 25% of the medication. So that might mean that you're going to basically your medication costs will go up, and that a lot of people don't like going into stage 3 because the cost of your medication will go up. In previous years, the donut hole, as they used to call it, you were paying a higher percentage of your medication. So it's a good thing that that has changed and that we don't have well, they still using it coverage gap stage, but the donut hole, so quote quote, uh, it was a part of the ACA, Affordable Care Act, that would go away. So you would not have this extreme, increase in your medication costs because you're paying higher percentages. I do believe in the donut hole, your medication cost for your brand names was almost like 40%. It was like 37.5% if you hit the donut hole before they got rid of that. But now everything is 25%. Your cost is still gonna go up if you are on a brand name medication that the cost was, $200 and you were paying only 40. You're gonna pay 20% of that medication. So that means you're gonna be paying like $100 instead of 40. So, but anyway, the same rules apply as far as moving from stage to stage.
Okay.
Okay, in that within the coverage gap. Again, when your medications reach a certain point as far as cost, then you move out of that stage. So when in stage 3, the maximum is $6,000. The cost of the medication has to be, well, once it hits $6,000, you move into the catastrophic stage where you now, I think they feel that, they take pity on you, that your medication cost has been so high.
Oh, really?
Yeah, they take pity on you. The medication cost has been so high, you've been paying so much,
Okay.
in this gap that they reduce it totally down to you go back to a copay stage of paying for your medication, in that you will now pay $3 for your generics and $8 for your um, brand names. It's $3.40 and $8.70, I think. But like I said, everything changes for 2021. Okay, so that's why it's very, very important to sit down, review your plan with someone like me. You can always call me, but you need to review your plan to make sure the medication you have is not going to cost you any more when you go into the new year. Okay, you can basically move to the next slide now, because everything I just said is going to be in print. If they want to take a picture, they can. But
Okay, and what is there a? I'm
it's
not.
it's basically Part D. Well, actually, don't do that. Don't do that. We can you just leave it as it is, because I just realized I put in the 2021 numbers already, so I can't show that.
Aha.
Yeah, so I take that back. But so it's very important for during annual enrollment period that everyone reviews their plan and sits down with a consultant, a professional that can go through their plan with them. And Medicare really pushes this. They really want beneficiaries to sit down and review their plans during annual enrollment, because they don't want you to get caught in a situation where you didn't review your plan, the medication went up, or even in your Part C plan, some benefit that you were getting, um, you're no longer going to get. The plan that you're in is getting rid of it, and you're no longer going to get it. So it's important, even though a lot of people stay with the plan they have, but make sure that if you're staying with the plan that you have, you've reviewed it, you've gone through it, you looked at your medication costs now for 2020 compared to what it's going to be in 2021. And how do you know whether or not it's going to be different? Because each plan is required to send them a summary of their benefits, or changes, I should say summary, the changes of their benefits of their plan for the following year. Okay, so they should start receiving those probably right October 1st. They should start receiving their um, new plan benefits for the new year. I should say their plan benefits for the new year. So they'll be able to do some comparisons. Um, and at the same time, Medicare.gov, as of October, around October 1st, they start sending out the Medicare and You book if you actually requested a print copy, because a lot of times they basically stop sending out the hard copy, and they basically have it online at Medicare.gov. So they can basically go and get a PDF copy of the Medicare and You book. And in that Medicare and You book, the update for the new year, in the back of the book, there are the Medicare basically has reviews. They do a star system, and they tell you what the benefits are for all the plans in your area. So that Medicare and You book is, to me, I always took my mom's because I was a Medicare beneficiary. But I always took my mom to look at it, because it always come in the mail, and she just handed it to me because she knew she wasn't gonna look at it. And so many beneficiaries do that. It's like a doorstop, But you really should, look at that and review it, and do some comparison. Do your own homework. It's nothing wrong with doing your own homework, but also look for a professional to help you as well, because there are questions that you may not be able to answer. And we are those of us who are in this field, we are certified, by Medicare every year. We have to go through our certifications, and for every company, we have to do the same thing. So they drill us down and test us and make sure we know what we're doing, and we have all the information at our fingertips. So I've been doing this for 10 years now in the Medicare arena. I know it like the back of my hand, but I'm always basically learning more, uh, to make sure that I am up to date on all the things that are new for beneficiaries to learn about. So, but that's all I have. If no one had any questions about it, then that's the kind of like the nit gritty, ins and outs of Part D. Um,
Okay.
okay. Oh, one thing I forgot to say is that if you're new to Medicare, or even if you're old to Medicare, and you have not been in a Part D that's been in a prescription drug plan that has been that Medicare considers credible, and you sign up late, you will get a penalty, a fee of it's basically 1% times the national average. It's 1% times the months that you could have been in a Part D or prescription drug plan times the national average, and then that stays with you forever. You do not. That does not go away. And
Another reason to call you.
yes, another. You don't want to not sign up when you're supposed to at all. So
Right.
uh, I would love for people to basically follow me on the YouTube station. So if you enjoyed or you got a lot of information from this session, just click on the subscribe to YouTube and like or follow. What is it? Like on Facebook, um, and join me once a week. All right, I will be posting a lot of things. I will probably be taking a little vacation, so I won't be here next week. I wanted to talk about that. I won't be here next week. As far as live, there will be information put out, but I won't be here next week live. I'm taking a little break, but I'll be back. So I look forward to coming back live in September.
Okay, fantastic. Thank you, Vickie. You're a wealth of information, and I look forward to hearing more about your annual enrollment period. Thank you. Bye, everybody.